The challenges that came along were multi-level. First of all, we had to grow the hospital. We had to provide physical facilities for our physicians and patients. The challenges came to us multifold, you know them. The insurance payments, the location of Southview, all those things we needed to do to build. And they weren't without obstacles.
No, they weren't. And even as the merger was evolving, there was difficulties with the staff. I think people don't appreciate that the hospital was built by spouses that went door to door to raise money. It was built by a tax that physicians placed upon themselves when they admitted patients. And then as we approached the need for a merger, I think physicians felt like they were almost failing, on their own mortgage payment. And that posed a challenge to get physicians to the point to recognize that healthcare was changing, options were limited.
One of the things that happened is the Balanced Budget Act of 1997, where they balanced the budget on the back of hospitals. And so by 1999, hospitals were closing just all over the country. I think RJ had good foresight to make sure that it merged.
Certainly a time of not knowing what was going to happen. From my perspective, looking back, could not have gone any better.
That negotiation process was the preservation of our educational programs.
Absolutely.
They are as strong now as ever.
We called to their attention the fact that this institution and this profession has a long history of educating physicians. And our affiliation with Ohio University College of Osteopathic Medicine was important. And we recognized that, and we recognized that that couldn't go away, and that we had to build language into the merger agreements that protected that, not just for today or tomorrow, but infinitum, forever.
When you look at the Christian Foundation of the Kettering Health Network and their emphasis on healthy eating, healthy lifestyle, as well as spiritual well-being, it blends nicely with the holistic approach of osteopathic medicine and caring not only for the physical well-being of the patient, but their emotional well-being and spiritual well-being.
Just coming off that highway, going back to your original vision with cleaning up the neighborhood and getting the boulevard coming up to the hospital and enhancing just being able to get to the hospital.
I can remember the initial resistance we got from the city that, but taking down the houses and those buildings and then redirecting the street and all of that. But they got on board and then they were big supporters of that.
One of the biggest challenges we had was we were challenged we were going to have to implement EPIC, the electronic medical record, and it was a mandate by the federal government that by such and such a date we had to have electronic medical records implemented. And we talked about that's either going to go really well or it's going to go really bad. And what I'm excited about looking back on is I think it actually went really well, where many of the physicians here at Grandview looked at it as an opportunity to be more efficient. And instead of it weighing them down, many of the physicians took it on as a challenge and learned how to use the electronic system to actually be more efficient.
It was just a learning curve and switching from an old system that all of us had grown up and trained with. One other thing that I'm very proud of is the start of discussions about creating a trauma program at Grandview.
Yeah. I think the day before I started as president, we had the trauma, what was that called?
The verification
survey, which followed many months of preparation that led up to that. And from that point forward, it was all systems go.
Yeah, we may even blame Richard because that consultation or the consultants that recommended that Grandview may be able to see 300 traumas a year, I think they underestimated as we're almost close to 700 in 2017 and maybe even surpassing that. More. But I agree with you. I think the growth of Grandview has been absolutely huge, and that halo effect that trauma has played a role in. And what I've really been thrilled about seeing is that each department continues to grow. You see an enthusiasm within the staff, from nurses to the OR staff to all the physicians here. I think there's a great pride in how Grandview has really transformed and has been a pillar in the network now as a trauma center.
Another big accomplishment, I believe, was building out the 4th and 5th floor of the new West Wing. Those were the first, really, because we don't really count ICU beds as private rooms. Those were the first private rooms for Grandview after, 88 years. That was really a huge step, I think, for the community.
Having that privacy for the family and the patient and helping them get back to their health, I think it's just been an amazing transformation, and we just keep asking for more and more rooms. But I think that is definitely a seller. I think the community loves it, and it's a great aspect for the community and helping our patients. So that was definitely a great addition to the hospital.
One of the things we need to work on for the future is expanding Southview.
It was really well ahead of its time and a forerunner of a lot of the ambulatory centers that have sprung up since then.
People get great care. The staff there is just absolutely top-notch, and I think like you said, it was almost a model of some of these freestanding and some of the centers that are being built today. That is a center that basically stood the test of time.
It's ideally situated right there off of the freeway. It's one of our hospitals that has probably one of the best access points to the highway systems that are out there.
Most people don't realize about Southview, it is the second largest surgical program too within Kettering Health Network. And the hand center, the orthopedic surgery center there, is extremely busy, and I think OB and orthopedics have really helped that campus.
And I think we're busting at the seams still.
I think it needs more space.
I agree. That should become a 2-story tower perhaps, or
Maybe a 3.
3-story.
Yeah.
Mm-hmm.
It's been a very, very active time as far as, like I was thinking about when I was driving down here, like, what have we done? I think, at this point, there's a lot of changes that are going on with the new medical education stuff. Grandview is such a, machine as far as taking good care of patients and producing well-rounded residents that, from my standpoint, I just wanted to be the person between the medical staff and the administration.
It's so important to have young leadership stepping up. That gives me faith and courage that we'll continue that transition.
As far as things that we need to make sure moving forward is we have to keep the residency stuff.
Yes.
I think that's key to, that's why I'm here. I remember going through at Ohio University that I wanted to come to Grandview. I wanted to come here because of the larger hospital and orthopedics, and I've just never left.
One of the challenges is this transition from our internal medicine docs being the hospitalist, as well as having a practice, as well as doing endoscopy. And now they're asking for help to cover the hospital.
Sure.
So I think for the first time, we're stepping into having hospitalist medicine at Grandview. So we're recruiting for that and partnering with both Unity and KPN. We have a great medical staff.
Oh yeah, and it's rare,
Yeah, it's
and
very rare.
It's very rare to see anything like that.
And they so love Grandview that it's just so apparent to me that they really care about this hospital.
Yeah, I think everybody that comes through here just becomes part of a big family. Especially if you trained here, and even if you didn't, but a lot of the people that are here have trained here. So it becomes home.